I had here two main talks. One was on the quality of life of a couple after radical prostatectomy, which is a very interesting talk because the quality of life is always in a scientific debate is just something not so important in terms of presentation and also interest. And I think in this question of mostly prostatectomy, for example, or taking care of prostate cancer, the quality of life of a patient is really essential, and the patient thinks really about that more than other type of tumor, I think. And the problem is the quality of life of this patient is a combination between the patient himself, but also the society around, and mostly the partner, the wife, and it's a very important impact, including sometimes very severe impact. You know that the risk of suicide of this patient sometimes is around, in some publication, around 5%, so only the risk, but of course it's not the final situation. And we talk about that, and we focus about what to do and how to improve the relation between the doctor, the patient himself, and also the partner or the wife. And this is important thing, and they were interested by this kind of topic because it's unusual. And the second talk was about the new paradigm or new data about what to do with advanced tumor, but with oligometastatic. That means the patient having a small number of metastases. So the problem is to treat or not the primary tumor. And this idea is a strong idea now, and what it's observed now that when there is a small number of metastases, the role of the primary tumor is probably important in terms of risk of dissemination elsewhere, and it's probably very important to treat the primary tumor, but also the other spots, usually maximum 4 or 5 spots, and this improves the survival of the patient. But you are really at the beginning of the information that we could have and could tell that we have to do it, but we know that the orientation is probably that we will do it in the future to treat this patient like a patient having only the primary tumor involved in the process. So this is main things, but this meeting is very interesting because the quality of people, of experts are very high. And I think it's a hard time for the people listening all the presentation because it's a very high level and a very strong data. And the data now is increasing a lot, and we have to find the right solution and the right idea in order to go toward the right direction.